I start today's video, I'm just going to reintroduce myself, considering that I almost have 1,600 subscribers. I am so blessed to have this many subscribers, and I never would have imagined that, like I said, my channel would grow as quickly as it is. So for those of you that have just joined my channel or are more recent subscribers and are watching this video, welcome to my channel. My name is Maddie. I've been a type 1 diabetic for just over 2 years, and I am in pursuit of a degree in dental hygiene. I'm going to be entering my second year of dental hygiene school very, very shortly, and I absolutely love what I do. I love interacting here on YouTube with you guys. In my spare time, I like to create art. Like I said, I love the videography. I also love doing photography, anything artsy, anything that keeps me creative, anything that allows me to also interact with the sciences and people is what I love doing best. So as a little bit about me, I have a dog and 2 cats that absolutely love to do anything and everything. So they're always fun to hang out with, and I'm a firm believer in God, and I love my family, and I absolutely love meeting new people and interacting with people. So a little bit about me, and with that being said, we'll jump right into today's video. It's Maddie. Welcome back to my channel, and as you can tell by the title of today's video, it is part 2 of my dental hygiene school update. As you probably saw in one of my last videos related to dental hygiene school, in July we had to make up all our second semester clinical requirements, clinical hours, treating patients, and so on and so forth from March through May basically. Because of COVID-19, our school shut down, and the vast majority of schools, colleges, and public buildings and public areas shut down for quite some time to try to slow the spread of coronavirus. So our college actually reopened in June. That's when the second year students finished their clinical requirements, and then July was when we were allowed the opportunity to finish our stuff up so that we can go on to the next semester and keep going as fast as we can so we can graduate, right? So anyways, summer went really smooth, and I can definitely feel the growth that I've went through. Just from the beginning of the semester to the end, I'm getting faster. Things are making a lot of sense. I'm getting the flow of things. I'm figuring out what works best for me as a clinician, because honestly, they teach you general things, but there are just some ways that you work in people's mouths that you have to be a little bit different for. For example, my fingers are super long, so I have to use some more alternative methods to place certain instruments in people's mouths, and certain different positions where I sit myself so that I can keep my body neutral. Everybody's situation is a little bit different, so I definitely learned a little bit more about what ergonomically works for me as well, because I want to have my body to be a hygienist. I want to have good posture. I want to have the ability to practice for as long as possible. So it's very important to keep your ergonomics up right from the get-go and focus on that as much as possible. So I'll kind of go into how July went. First, it started off where, like, the first day that we were back, we weren't treating patients. We were actually in all day long for 8 clinical hours, doing instrumentation evaluations, and then learning a couple things that we missed from seminar days in March and April. So we did things like learning how to place sealants and airflow polishing, which are both super fun. And any of us that had any remaining evaluations that were not complete on patients, actual patients, we had to complete on a mannequin. And I think I only had 5 or 6, I want to say 6, that I had to do on a mannequin. And most of them I was going to do like right away within like that first couple of weeks, like right after our spring break was supposed to end, kind of in the middle to late March. But then unfortunately COVID-19 happened, and we couldn't control the situation at that point. So otherwise I would have had all my skill evaluations done like in like the end of March, beginning of April, with like a month and a half to spare as far as like getting them in before the true semester would have ended, if things would have continued in a normal progression. But I only had the remaining 6 and did those. That was great. And that was the first time I ever actually like worked inside a clinical setting with my loops, and they said put them on if you have them, and I was kind of like, I don't know if I'm quite ready to do that, but I did. I jumped right into it, and it didn't really mess with my ability to perform. So Obviously, the practice that I got on Kevin, well, you can see is no longer here. Kevin is back at the school, probably going to be given out to a first year or an incoming dental hygiene student. So I obviously got enough practice on Kevin to really get the gist of what it's like to work with loops, and I've been wearing my loops for all my entire patient treatment, and I really enjoy them, and it's definitely made it a lot easier to see things, adapt things better in the mouth, and I love the light that's on it because it gives an additional enhancement to the mouth so that I can see in more specific areas, and like I said, especially the teeth that are way in the back. Obviously, they're covered by cheeks and lips, so it's kind of hard sometimes with just the regular dental light to use that. So to have the loop light has been super fantastic. So that was our first week, and like I said, it went smooth. And then the following 3 weeks in July, 2, 3, and the second, third, and fourth weeks in July, we each were broken up, like I said, into 5 groups. I was in group 3, which means that we were in the clinic Mondays and Wednesdays. And then I think there was 2 other groups that we were with. I think we were with I want to say group 1, don't quote me on it, on Monday, and group 5 on Wednesday. And then everybody had their own staggering and stuff. So I was in there all day Monday and all day Wednesday for 3 weeks straight. Mondays were like 8:30 to 5:30, I think, yes. And Wednesdays were 7:30 to 4:30. So we were there all day. They gave us a lunch break, and obviously we're not going to expect our patients to sit 7 hours straight, and I think I would be dead tired if I sat 7 hours straight. With the clinical requirements and with me learning and stuff, it would be very overwhelming. So we did a traditional clinical session, the 3-hour length, and then we had a break, and then we did another 3-hour session. The reason why they did this is because there wasn't enough time to break it up into smaller chunks. We kind of had to cram 2 weeks of hygiene in 1 whole week. So that's why we went 2 full days. A week of hygiene for second year or second semester students is considered 2 3-hour clinical sessions. So you were doing 2 3-hour clinical sessions on a whole entire day. So therefore, when you're there twice a week, it's like 2 weeks of dental hygiene. So I did 6 weeks of dental hygiene in 3 weeks, or 6 days, 6 full days. Kind of crazy how they were able to calculate that and figure that out. But like I said, the Wisconsin Dental Board, the Dental Association, American Dental Association requires I have so many clinical hours treating patients, I have so many clinical hours doing this, so many clinical hours doing that. So they somehow had to incorporate that while allowing us to continue our education. So everything went super smooth, and I was able to meet all my requirements comfortably and exceed them. I did treat 4 patients that were adult patients and 3 child patients. So, and actually started an 8th patient who was very kind enough to come back for me in the fall. Unfortunately, it wasn't anything I did. It wasn't anything that was messing with his schedule. Unfortunately, just the timing of things and the amount of time I was given to complete certain patients, I didn't have enough time to finish him. I have him started. I have the assessment data complete. He will come back for a few more times in the fall for me to finish his actual cleaning. So very, very lucky that happened that way. So in essence, I finished 7 patients and started an 8th. I'd say the most of us were in that level, and there's some that were higher. Just the way how things panned out, or it just depends on how many patients they had finished before COVID and all that different things. So like I said, I got a lot of really good experience. I really enjoy working with my patients. Like, I could see the growth week to week. I can see how fast I was getting, how comfortably I was able to experience things and talk about things to my patients. And like I said, my favorite part beyond just the clinical side of cleaning is like literally the education behind it, because you need to be able to educate your patients on what the status of their health is, or their oral health, and help them find ways to improve it, make it better, keep it stable. You know, everybody's situation is different, and what I kind of like about seeing patients multiple times is that you can actually see the change week to week. You can see the change and maybe improvements in their brushing, maybe their flossing, maybe the way that, you know, their body is responding to different things, maybe the way that they are responding in the chair. Some patients come in more apprehensive, and maybe they leave by the final time you see them, maybe they leave not apprehensive about the dental setting anymore. And to be able to calm that dental anxiety, to make a patient feel comfortable and understand where a patient's needs are, is extremely important. And not everybody's needs are going to be the same. Not everybody's able to do everything or need everything that they need right away, and you need to be able to grow and build on things and not throw all kinds of things at once at your patients. You gotta take baby steps with your patients. Not every patient is going to be able to commit to certain things right away, but maybe just adding a little thing here and there would make a big difference in the health of their mouth, and it's absolutely huge to see that change clinically. Like I said, I think the hardest thing, like transitioning back, was like all the PPE we have to wear, and it's not so much the amount, it's like how hot it makes you. Like, I don't mind wearing the layers, but I don't like feeling like I'm sweating all the time, if that makes sense. Beyond the traditional lab jacket, gloves, traditional mask, and safety glasses and or loops, we had to add an additional 3 pieces of PPE. First one was a hair bouffant. I have to have my hair covered because, theoretically speaking, by the Centers for Disease Control, any aerosol particles can drop on my hair. And theoretically, if I lay on my pillow at night, I could have viral particles or any type of bioburden particles on my hair. Although the only silly thing I don't get with that is, like, why would I not take a shower after I'm sweating all day? I mean, I don't really get... I guess I understand the reasoning. Like, you need to have that kind of protection because the hair obviously you can trap a lot of wet spatter or particles or aerosols that you can't even really see or feel in your hair. But, like, it's not like I'm gonna lick my hair or go to bed sweaty. I mean, like I said, I see the point, but at the same time, common sense says if you're that sweaty, take a shower before you go to bed, and don't lick your hair. I don't really know too many people that lick their hair. I mean, sometimes, like, you put a piece of your hair in your mouth if you don't realize it, or like sometimes I'll futz with my hair, and maybe that's what they're kind of getting at, is people that futz with their hair, then touch their mouth or touch their nose or touch their eyes, and then you're gonna infect yourself. But honestly, even before COVID-19, we had to wear our hair in, like a ponytail or up and out of our face, obviously, for not only our protection and our safety, so we didn't get hair in the face. Obviously, the patient isn't going to want hair all over them either. But honestly, even before that, taking standard precautions, I never, like, after a clinic session, I knew, like, don't touch your hair, take a shower when you get home, and then you can, futz with your hair or whatever. So it's not like I was actively touching my hair or messing with it or putting it near my face or something like super near my face where, like, I could have infected myself. The other piece of PPE we have to add is a face shield. So you would have your traditional mask, eyeglasses, and then a face shield over the top. And actually, I actually really enjoy having the face shield to a certain degree. Number one, especially if you're spraying water or a patient's saliva is kind of going everywhere. I've actually had amounts of it hit my face with the face shield on, and I've had to wipe it off. Because some people, depending on how their saliva flows, how their mouth is shaped, sometimes when you place the suction in their mouth, things just go flying. So I really am comfortable with the face shield. And then beyond the face shield, we had to wear a KN95 mask underneath a traditional surgical mask that we're used to. And that actually wasn't so bad. The face shields they originally gave us, talk about the face shields a little bit more. I talked about the masks, which are kind of obviously, like, because of COVID-19, we have KN95s or N95s for the viral protection. But the face shields they originally gave us, I didn't really care for, and now I like the one I have. The original face shields they gave us were have a styrofoam, tight piece here, and then it wrapped around your head, and it was really tight to your face. So I feel like it was way too warm for me, and I also couldn't use my loop light. I could use my loops, but not my loop light. And then we had the option to purchase a $20 face shield of higher quality that comes out farther from the face, has an adjustable head strap that sits right about here in comparison to your face, so that you're able to comfortably have your loop light shine through the shield while at the same time protecting your face from any water particles, saliva, you name it, any bioburden that comes out of a patient's mouth. Or lands anywhere, you're going to be able to protect yourself. And I'm glad I made that investment. And the face shield now isn't as bad with, that it fits over my loops better. I don't feel like it's so tight to my face that I can't breathe or it's too warm. But honestly, that was probably my least favorite part of the PPE. But now it's the hair bouffant that I can't stand. I honestly wish I could braid my hair myself, put it into an actual braid where it's right at top to the head, because that was the most comfortable thing to slap inside a hair bouffant. Normally I put it in a ponytail and I kind of twist it up. Some people put it in buns, however, because if people put their buns sitting higher, they may have to wear 2 hair bouffants or clinicians with thicker hair, or just the way their hair is kind of laying on their head, they may have to wear 2 hair bouffants to cover everything, and I think it just traps way too much heat, and that's probably my least favorite part, is wearing a hair bouffant. And honestly, we have the disposable ones, like the lab jackets, and I feel like they're super warm. If I had like my own cloth or reusable hair bouffant or like a reusable lab jacket, I think it would be more breathable, to be honest with you, instead of trapping all that plastic heat inside of you. But it is what it is, and we have learned to deal with it well. And like I said, the PPE for a long time exhausted me. I'd come home from a whole day and I would just like be exhausted. And it truly really wasn't my breathing or anything. I just would feel so warm, like my body would feel warm, and I'm like, don't take my temperature. Now if you wanted to test me, I feel like I'd be running hot, or something like that. But that definitely wasn't the case. Protocol wise, everything went pretty smoothly. A couple of my classmates had some issues with patients who were sick, and they obviously could have been exposed to COVID-19, so they couldn't come. I had that situation also with a different patient who will be seeing me right away in the fall sometime here, so that should not be an issue. But I had plenty of other patients that were willing and ready to come in for me. Heaven forbid somebody ended up sick with COVID or had symptoms. We don't want any patient coming in with fever, cough, shortness of breath right now. Or a patient who possibly, or a patient who's quarantining because they may have been exposed to a COVID-19 person, or a person with COVID-19 or possible COVID-19. So all our patients, like ourselves, were temperature checked at the door. Screening questions were asked in the chair. We have to ask screening questions before we go on campus. Any patient with a temperature higher than 100.3 was sent home. Any patient who answered yes to a couple specific questions on this questionnaire were asked to reschedule their appointments, or it would be reviewed and then determined by an instructor or the dentist if they would be allowed to stay. And like I said, it's not so much I'm worried about getting it because I have the proper PPE. And right now the clinic is trying to get engineering controls in so that we can use ultrasonic again, that we can polish again. Because of COVID-19, we really can't do a lot of stuff that produces aerosols or particles in the air. So in order to remove plaque on patients' teeth, instead of polishing, which is what everybody likes, that vibrating little piece that kind of looks like a little electric toothbrush, we had to manually brush our patients' teeth. We could not use ultrasonic instrumentation, which can kind of be a setback because it does save a lot of time when it comes to removing hardened deposits off of patients' teeth, whether they are above or below the gum line. So we had to scale by hand, which honestly doesn't really bother me too much. I don't mind hand scaling. I actually really enjoy it, but there were some moments where I'm like, I'd really like to polish right now, and I'd really like to use the ultrasonic right now. We also couldn't air powder polish, which is one of the seminars that we learned. We learned how to do it on a mannequin because obviously a mannequin isn't a real life person with saliva or anything like that could send all kinds of particles at our face. When we suctioned our patients out, we had them close their lips around the water squirting device, which is what we call the air water syringe, and then we had them swish around like mouthwash, asked them to open their mouth, and they would close their mouth on the suction instead of keeping it open and having things spraying over. So we were doing 2 or 3 extra added things to produce the most minimal amount of aerosols possible. And even with those protocols in place, there's still going to be aerosols to produce. Like I said, aerosols and spatter. I had, like I said, some water from a patient's mouth or some saliva go up at me at my face shield. So like I said, it's there. As soon as we get the engineering control to help control some of the aerosols that are produced while treating a patient, we can start implementing certain things that produce aerosols that won't be as harmful to us of a risk of having COVID-19. And I think adding that screening precautions to our patients, temperature checking, patient questions, stuff like that, not treating anybody with fever, cough, shortness of breath right now, is only going to help. Now, like I said, some patients are going to say, oh, I have a smoker's cough, or I've had a chronic cough and I had tested negative for COVID. Well, that's a different story. Or some people have asthma or COPD or something of the sorts. They're going to have coughs and, cough around and stuff like that. But if it's a cough, anything related to COVID-19 with a fever and shortness of breath, or any of the 3 combined, we are not treating patients that are ill. And like I said, it's to protect other patients, help slow the spread of the virus, and protect us. We're in all the PPE. Patients also are required to wear masks when they come enter our clinic, and I would say that's the case for the vast majority of offices. I know some states are doing things differently than others, and like I said, I'm from the state of Wisconsin, so anything dental related that is in different states, I don't know your situations. Everybody's situation is different in regards to whatever state you live in. And like I said, the county that my school is in had a high incidence at one point. Unfortunately, because they do cumulative totals with COVID-19 positives, people look at that cumulative total and think like we're so high. Well, the vast majority of those were back in March and April from meatpacking plants. Unfortunately, there was huge spread amongst all these meatpacking plants, which caused huge surges of COVID-19, and the increase of positives was significant. However, daily we're not adding too much in the county that my school is in, so we're a pretty low incidence so long as you take your standard precautions, avoid people who are sick, and physically distance. Patients also are not allowed to wait in the waiting room anymore. They are checked in immediately at the front desk and taken back to the operatory by us. Again, and that's to protect them more so than us, because we don't need them mixing and mingling with other patients who could possibly be carrying the virus. Now, mind you, the patients aren't let into the building or beyond a certain point in the building until they are temperature checked. So the odds are pretty small that they would interact with someone like that, but because we don't want people congregating in a small area that is not able to be distanced 6 feet apart, we couldn't allow anything like that with patients. So that's another good protocol. Having patients show up right for their appointment time, not sit in a waiting room, is probably a very, very smart move as far as not allowing people to congregate for too long to spread it. Summer went pretty successfully for me, and I'm very proud of myself, and I absolutely love what I do, and I feel very blessed to be in this program. I'm blessed to now be a second-year dental hygiene student officially, and we start back up August 20th, and like I said, we're running clinicals 4 days a week for most weeks, depending on if we don't have a lab day or something else built in. I have my schedule out, and I'm currently scheduling patients, finding patients, scheduling recalls, you name it. I'm scheduling all that at this point. So, like I said, I'm doing a lot of prep work, and if you don't see me on here a lot, that's probably why. Plus, all the courses that are related to lecture are going to be either an online component or a WebEx component where we actually meet virtually with our instructor. And then I'm only going to be on campus for the clinical hours or the clinical aspect of my experience for the semester 3. So process 2 is officially done for me, and I did well. I'm proud of myself, and I don't say that enough to myself. And like I said, I absolutely love what I do, and every moment that I'm in clinic, I absolutely enjoy working with my patients. I enjoy learning. I enjoy seeing how different everybody's needs are and making care plans for my patients. Like I said, oral health is absolutely huge to the vitality of your overall health, and I was given some pretty cool opportunities that I just went through as far as dental related things. I'm very blessed to be given certain opportunities. I'm blessed to be in the situation I am in right now as far as getting my schooling done, and like I said, I am nearly 22 years old, and I will be 22 when I graduate next year and take 2 board exams to become a registered dental hygienist. So cheers to year 2, 2 more semesters and 2 board exams are between me and me being a registered dental hygienist. Advice for any of you going to like dental hygiene school and like going through the clinical part of it is like, don't beat yourself up over the small things. Take each day as a new day to learn. Don't compare yourself to others. Do your best with what you're given, because some days are going to be easier than others. Some days you're going to feel like you're rocking. Some days you're going to feel like you're failing. Trust me, you're not failing, you're learning. And like I said, if you make a mistake, you make a mistake. Learn from that mistake and move on. Find a way to improve yourself. Improve the way you're communicating. Maybe it's improving the way you're setting yourself up. Maybe for me, in my case, it's improving your ergonomics and not letting yourself slouch in the chair. Not that like I slouch super often, but I catch myself not having proper posture, and it's definitely taken a little bit of a toll on my body. So like I said, that's extremely important, and I will open up more about dental hygiene school as I go through it, and as I complete things I'll keep you guys up to date. And like I said, I appreciate you guys learning a little bit more about the side of my life beyond type 1 diabetes. Like I said, learn from your mistakes and, take your instructor's advice. Work with them one-on-one if you need to. And like I said, I have the most kind instructors that I've ever met in my life. And there's more that I probably haven't really met yet or haven't really interacted with, but every single one of them has been more than helpful. I've learned a lot of different things from a lot of different people, because no two of the instructors are going to have the exact same ideas on how to go about things, and they've all seen different things clinically and have been practicing dental hygiene for a long time. So it's really cool to experience that, and they've been nothing but kind to me, even especially living with type 1 diabetes. They've been nothing but kind and supportive to all of my classmates, and they're there to help you. They're there to guide you. They're there to shape you into a really strong dental hygienist in training. They're there to shape you into a great clinician. So really work on keeping a strong relationship with them, because they're going to give you lots of good advice along the way. And don't be afraid to ask questions. Kind of not really slammed an instructor, but I asked several questions in one day. And like I said, I'm not afraid to ask those questions, and they're more than happy to answer or guide you in the right direction if they can't give you an exact answer. They're not going to hand everything to you on a silver platter, because they expect you to do things on your own, but they can guide you in the right direction or give you an answer that will probably pinpoint you in the right direction to get through something, whether it be in the classroom or in the clinical setting. So anyways, I hope you guys enjoyed this video. If you did, give it a big thumbs up. Feel free to hit that subscribe button. I post videos every single week about diabetes plus more. And until next time, for another video, take care, God bless, be kind, spread positivity, and be thankful. Bye.